Thank you, everyone. Lovely to meet everyone. And really, thank you for the opportunity to share some of the work that we're doing at the Sustainable Hospitality Alliance. Very quickly, just to give a quick introduction of who we are. We work with a number of large group of hotel companies, as well as those who are in the value chain of the hospitality sector. So within the hospitality sector, we have a membership which represents more than 50,000 hotels across the globe. So it's a good spread, nearly for more than 40% of the industry. We work with delivery to deliver work. We work collectively at both local issues as well as global issues. Our members, along with the value chain, contribute into the work, enabling us to together collaboratively tackle and create more joined up industry approach to tackle sustainable issues. While we do that, we also have a collaborative agreements and partnerships with governments, not-for-profit, and other sectors to work collaboratively with the hospitality industry, both in local, regional, and global issues. Our approach is for the industry to be net positive, for it to give back more than what it used to people and to the planet in places where the industry and its value chain operate. A key strategic area for our work is human and labor rights. And one way we have approached it is to work on employment and employability, especially of youth at entry level. Employment data, as we've seen, is available and it's really good. However, as the main purpose is to use it for reporting, its analysis gives only the big picture of where some of the more granular issues may be. It is not enough to inform actions, especially action that needs to be taken at, say, the hotel level or other organizations who are working in the value chain or supporting at community level. More granular or differently disaggregated data is essential, and this is for action. And the great thing is it can be collected easily and its volume can be small. So we tested data collection and its use in the context of the employability program, which specifically skills young people and excluded groups and brings them into employment in the hospitality sector. The program had been running for nearly 10 years. It is a community-based program involving both NGOs and hotels to work collaboratively in delivery. But we were only capturing graduation numbers for most of this time. In 2020, we started looking at enrollment numbers, dropout, and employment figures were included. Now, the data started revealing some underlying issues. We found low participation by women and high dropouts. But we had no idea what happened after graduation, after they graduated the skilling program, what happened then. So we added employment data and we realized that there is good potential for women, but we are losing them too early. Now, this is data that we were able to collect with our key partners, which are hotels, as well as the not-for-profit or social organizations that were working and connected directly with the young people. To find solutions to issues, we needed to get behind these numbers. So we had to get qualitative data and make sure that there was a system in place for us to quantify it for analysis and use. Qualitative data collection does not have to be costly nor time consuming. And this was a concern that some of our partners initially raised, but we worked out a good, simple method. The purpose has to be different, not for reporting or writing case studies or best practices, but this time the purpose was to inform actions to resolve some of the issues that were coming up and to think outside the box. Now, what we found as we collected the qualitative data and paired it with the quantitative data, we found, for example, that night shifts caused tremendous hesitancy amongst youth who are just learning to adjust to a full-time working day. They come from multiple different backgrounds. They may not be used to working a full, organized 8, 10, or longer hours in the job. This was especially true for women who had other duties at home, and traveling at night was not appealing or safe. We discussed this with the hotels, and they responded by changing the shift timings. And they made sure that the trainees who come in for these 2 months or 3 months during training were able to complete their training shifts earlier in the day and leave by evening or late afternoon. In another example, we found that there is perception that working in a hotel is not good. The perception was based on hearsay, or it was simply because people from the communities we were working with had never stepped into a hotel, nor did they know anyone who worked in a hotel. That caused negative perception, be it budget or luxury or any type of accommodation. So the participating hotels came up with some solutions. They invited families and prospective trainees, these were future workers, to come and see the properties and to meet with the workers. That helped to create the barrier, to break the barrier. Again, a very low cost, actually no cost action and simple to implement. Another point that arose through the data analysis we did was that when travel time between the work and home was more than an hour, the cost in terms of both time and transport was too high for those starting in uh, early positions. And this was true both for men and women. So NGOs had to rethink how they mobilized and placed trainees. They had to think um, by offering, by making sure that they were mobilizing trainees in relation to where the participating hotels were. Hotels also contributed. Oops. Hotels contributed by offering accommodation where there was no possibility of mobilizing from near their hotel properties. Because we work with communities with the highest need to access these opportunities, the hotels, instead of taking the easier option, which was let go of the particular vulnerable group and look for, just to fill vacancies, stayed with it and came up with a really good solution. So selective quantitative and qualitative data, regular analysis, and application for problem solving improved outcomes in a very short period of time. We started using the new practices as standard in new locations, and they worked. With this sort of a shift, especially in the enrollment, which is the intake, especially for women, became much bigger with more space to grow. The dropout reduced, which means the number in number terms, not just percentage. The women who were completing the program showed really good improvement. But more critically, the number of women who were coming into employment because of these very small shifts that we had taken grew substantially. In percentage terms, it showed an increase, but in number terms, the increase was much, much bigger. We've tested this out now in other locations as well to make sure that the practices that we were putting in place held true and they worked. We have most recently used these standards in Egypt, where we were being told that it is really difficult. Women's participation in hospitality, especially, is very low, and it is going to be tough. We've just last week actually graduated our first group, 26 trainees in the first cohort. 80% of them are women, and not one dropout. So outcomes continue to improve in each location. And we find better and more local solutions, and our partners sort of work on that constantly. But even more encouraging is that we are finding ways to measure the sector's net positive impact. We wanted to see the impact on people who have been trained with support of the sector and are now employed in the sector. We want to understand their capital gains and if they are in a better position to grow their capital. And we are finding that youth are in safe formal work for the first time in many cases, with substantial increase in income. And now they have the ability to save, which really allows them to build resilience against future shocks. Their successful first achievement into a formal job has increased their belief in self and aspirations, which means that they want to do more, and achieve better. The immediate support network, which is really critical for those who are coming from disadvantaged groups of those who are participation is low. The immediate support network of family and friends is much stronger, giving very practical support when needed, which means that there is potential now for them to grow their social acumen. There are other issues that are surfacing and will continue to surface as we clear the uh, the top surfaces out. They may be more difficult and challenging ones, but as we continue to identify and collect useful and comparable data, solutions will emerge, and especially at the local level. And with that, I just want to thank everyone for giving the opportunity to present.